Cycling is a unique sport because it requires your body to work with a machine to generate power. The bicycle holds your body in a fixed position as your foot pedals for thousands of revolutions around the crank cycle. Holding your body in one position for so long increases your risk for overuse injuries. That's why finding the right bike fit is so crucial. Hi, I'm Dr. Maria Conley, and today I'm going to talk about overuse injuries on the bicycle and how to find your perfect bike fit. When analyzing the geometry of your bicycle and your body in space, you want to maximize your power on the bike while also reducing your risk of overuse injury. There are three areas where your body contacts the bike: at the pedals, at the saddle, and at the handlebars. Applying excessive force at any of these areas can cause overuse injuries, leading to pain, numbness, tingling, or even sometimes weakness at the affected part of the body. Today, I'm going to focus primarily on adjusting saddle and handlebar height to minimize risk of overuse injury. The saddle can be moved vertically, horizontally, or tilted slightly up or down when positioned parallel to the ground. Your handlebar stem height can be moved up or down to adjust the amount of pressure and force that is transmitted from your upper body to your hands on the handlebars. There are some quick and easy ways to assess your overall body fit on a bike. And this essentially is your static fit while you're just not moving. Starting at the pedal, your first metatarsal phalangeal joint of your foot should be directly over the pedal spindle. Next, examine your saddle height. This is the distance from the center of the bottom brackets to the top of the saddle where you're sitting. While seated on the bike, make sure that your knee is just slightly flexed between 25 to 30 degrees from vertical when your foot is at the bottom of the downstroke. You can also estimate your correct saddle height by multiplying your inseam length in centimeters by 0.883. This is the Lemon method. Your saddle should be roughly parallel to the ground. When riding with your hands on the brake hoods, your upper body should be flexed at about 45 degrees. And when riding in the drops position in the aero bars, your torso should be flexed at about 60 degrees. Your handlebar height should be 1 to 3 inches below your saddle height. The most common overuse injuries on the bike involve the knees and the low back. Knee pain can often be alleviated by adjusting your saddle height. And this makes sense because remember that your knee should be flexed at about 25 to 30 degrees from the fully vertical position when your leg is at the bottom of the pedal cycle. In this position, you're maximizing the efficiency of your quadriceps muscle contraction, and you're also minimizing the compression force in your patellofemoral joint in your knee. The force on the knee increases significantly when the height of the saddle is lowered or when you're pedaling at higher intensity or in lower gears. In these situations, you're needing to generate higher forces across the quadriceps muscles to move at the same speed. And remember, the force across the quadriceps muscles is transmitted to the knee joint. To alleviate knee pain, you can move your saddle up higher or pedal at a higher cadence in an easier gear. Low back pain on the bike often means that your upper body is too stretched out. To correct this, you can move your handlebars up or ride in a more upright position. Essentially, when you do that, you're minimizing the compressive force on your lumbar spine. When your upper body is putting too much force on the seat, you can develop saddle sores, and this is common in the early season, or ischial bursitis. Here, it's important to use a saddle that fits your body type. Female riders often need a wider saddle. The width of your saddle should be 1 to 2 centimeters wider than the distance between the ischial spines of your pelvis. Overuse injuries also occur where your hands meet the handlebars. When your upper body is applying too much force to the handlebars, the ulnar nerve in your wrist can become compressed. Pinching of the ulnar nerve blocks the transmission of normal sensation to the small finger and the ring finger of the affected hand. This is probably the most common neuropathy in the wrist in cyclists. You may experience numbness, tingling, weakness over these affected fingers. So this is called ulnar neuropathy or cyclist palsy. You can offload the pressure on your hands and wrists by increasing the height of your handlebars, by wearing gloves with foam or gel padding, or by frequently changing your contact points on the handlebars so your hands are not always in the same position. Because your body is in a fixed position on the bike, it's critical to ensure that your body is positioned optimally for power generation and for injury prevention. Considering that your foot may move an average of 80 revolutions per minute and over 5,000 revolutions during a 1-hour ride, you really need to minimize the compressive forces acting on your body. Taking a few minutes to measure your fit on a bicycle can often prevent or alleviate painful overuse injuries that can slow you down in the long run. Thank you for listening. I hope that this was helpful for you.